Thank you, Madam Chair, and Ranking Member Scott. Thank you, Secretary Azar, for coming in. Secretary Azar, I'd like to ask you a few questions about electronic health records and the Meaningful Use program. Electronic health records were intended to improve patient outcomes by streamlining medical practices and making it easier for medical practices to communicate with each other. Fundamentally, they were supposed to ensure that patients were able to spend more time with their doctors and receiving better care. Unfortunately, a new study in the Family Medicine Journal, published earlier this year, found that primary care physicians spend more than half their day interacting with electronic health records and not patients. And this statistic, unfortunately, is very disturbing because, as you know, we want physicians and providers spending as much time with patients and not with electronic records. And this is, unfortunately, an experience that has also been told to us by other physicians, not just primary care physicians. I understand that CMS is taking steps to reform the system. Recently, you and the department and CMS have renamed Meaningful Use, quote unquote, as Advancing Care Information. And now the Merit-Based Incentive Payment System, also known as MIPS, is promoting interoperability of different systems. I hope these changes are more than just cosmetic, Secretary Azar, and I hope that they are a sign of meaningful changes to come. So what I wanted to ask you was simply this, which is, what's going to be the practical impact of these changes, and how are you going to measure whether they are going to be effective in, basically improving patient outcomes and allowing physicians to spend more time with patients?
Great question, Congressman, and thank you. The measure for us of interoperability and success with electronic health records is when the patient shows up, does their data arrive with them? We got to get out of the business of micromanaging the how of health records. And instead, when the patient shows up, is the information there? Do they own it? Do they have access to it? Does it carry with them? And get the doctor's eyes off the screen and on the patient. And love to work with you on any ways that we can support that vision. I think we're in complete agreement here.
I would love that. I think that it's refreshing to hear that you are trying to make sure that the information arrives with the patient and the eyeballs of the doctors are on the patient and not those computer screens, which we all see when we go into the doctor's offices. Now, the corollary question is, are you open to soliciting feedback from providers who are affected by these rule changes? Because I think that would be really important in basically refining the techniques that you are developing to streamline the electronic health record system.
Absolutely. I would love any input from any source on how to make this work better for providers and for the benefit of patients. And totally open-minded how to approach this and would love input.
Okay, great. We will
love to work with you on this.
Excellent. Thank you.
Thank you, Mr. Krishnamoorthi.